I'm here with Dr. Erin McGrath at Pediatric Dental Associates. Can you tell me a little bit about where you went to dental school and how you ended up coming to Pediatric Dental Associates for your pediatric residency?
I went to Temple University, Kornberg School of Dentistry for dental school, graduated in 2012, and then I went into the Air Force practicing as a general dentist for 4 years. I was stationed in Texas. I came back to Philadelphia because this is where I'm from. I grew up in this area, so I was fortunate enough to come to Temple for a pediatric residency.
Great. And is this the first time that you were exposed, like here at Pediatric Dental Associates? Was this the first exposure to Isolite systems?
I actually got to use it a little bit in the Air Force before I came to residency, so we had just gotten it and briefly was using it in there, so it was great there as well.
And what do you like to use the Isolite for?
I like to use the Isolite for all procedures if possible. Any restorative, sealants, anything, even extractions I'll use it for as well if I'm worried about, it helps to prevent the patient from swallowing the tooth.
What do you think the biggest benefits are?
I think the biggest benefits for it is safety, for one, because it prevents aspirating of materials, the teeth, crowns, anything we're using. Also, it does help to keep the tongue out of the way, keep things dry, so I don't have to worry about really worrying on my assistant to keep things, out of the way. I can kind of just do dentistry with one hand if I really needed to.
And you guys just did a sealant study for us, so measuring the time efficiency of using the Isolite with sealants, but you also had a control of using with just cotton rolls or other alternatives. How do you feel that went?
I think the study went great. I dread it when I had to do cotton rolls, so every time it came to, because we did a random standardized control, where we had a sheet that said whether we were using Isolite or cotton rolls, and anytime we used the Isolite, it was great because I didn't have to worry about, I had a free hand, like I said, otherwise I needed like 4 hands to do it with the cotton rolls, so it saved us time. It also made the procedure less of a headache, and I think the patient liked it better because I wasn't trying to put a bunch of things in their mouth at one time.
What do you think were some of the top key learnings from that study, just for you, having to go back to doing it without and then being able to use the Isolite on the other groups?
I think one big one was when we're using the acid etch, trying to make sure that we were able to just keep that on the tooth itself and not touching the tissue so that it didn't cause any issues. So safety was a big part of that. And then keeping the tooth dry to make sure that the material would stay on there. So when I had Isolite in there, I didn't have to worry about any of that. However, when I was using the cotton rolls, I had to worry about the safety of the patient, as well as how well the procedure was going to go.
And when you leave here in June to go off you might end up staying here, or if you go to another practice, is Isolite one of the key tools that you'd bring with you?
Yeah, and actually when I've been interviewing, that's been one of my the key things. If they don't have Isolite, I don't know if I would consider going there. So.
Awesome, great, thanks.